Hello, listeners! Welcome to KPAC 91.9. This is Kristen speaking, and this is the Script Your Future radio program. On our second show, we'll be discussing the importance of medication adherence as it relates to asthma while playing some sweet tunes. If you'd like to support the Script Your Future program, you can go to facebook.com/scriptyourfuture1 and like our page, or you can go to twitter.com/scriptyfuture and follow us. All right, now we're going to listen to some sweet tunes.
Hey guys, welcome back to the Script Your Future radio show, the asthma segment. And like Kristen said, we're going to be talking about medication adherence and how it pertains to asthma. So before we begin, I will give a brief introduction on what asthma is. So, what is asthma? Asthma is a disease where the airways become blocked or narrowed. Though these effects are temporary, they cause shortness of breath, wheezing, coughing, and chest tightness, and become a major problem in children and adults when trying to play sports or even trying to carry out day-to-day activities. While the exact cause of asthma is unknown, researchers believe that both genetic and environmental factors cause asthma early in life. Some of these factors include atopy, which is an inherited tendency to develop allergies, parents or family members who have asthma, respiratory infections during childhood, or contact with allergens and irritants early in childhood. The way asthma is diagnosed is through lung function tests such as spirometry, and this can be done at the doctor's office. So just to give you guys some statistics, an estimated 25 million people in the U.S. have asthma, with about 7 million of these people being children. And despite the availability of treatment, it still remains a poorly controlled disease. And just to give you an idea of what this means in numbers, asthma is the reason for nearly 500,000 hospital stays each year. So while there's no cure for asthma, you can take an active role in managing the disease through talking with your physician about creating an asthma action plan, which could also be found on our Script Your Future Facebook page, and through talking with your pharmacist about how to properly use your inhaler. With that said, recognizing signs and symptoms of worsening asthma, as well as properly adhering to your medication regimen, is key to keeping your asthma under control and keeping you on track to leading a happy and healthy life. So that was just a quick overview of what asthma is, and we are going to play a few tunes for you, and we'll be right back with Andy, who's going to give a quick rundown on different asthma medications, their side effects, and all that good stuff. So stay tuned, and we will be right back.
All right, welcome back, guys. Right now, we're gonna go over the different types of asthma medications. There might be some jargon in there that's kind of hard for people to understand, but just bear with me. I'll try to, dumb it down as much as I can. So there are many different types of asthma medications. There are 3 different types of transports for it. The first one being a metered dose inhaler. It is pretty much a pressurized metal canister that contains the drug. And advantages of using it include it being very compact and easy to maintain, and it also works for patients with low inspiratory flow rates. Disadvantages include having to need hand-breath coordination and the patient needing to hold their breath after using the puff. Another type of transport for the asthma medication is the dry powder inhaler, and advantages are that it's easy to maintain as well. It's also very compact, and no propellant is needed. Disadvantages also include needing an adequate inspiratory flow rate. And the third type of transport for asthma medications is the nebulizer. And advantages of the nebulizer include not needing extra breathing effort to use it. It also allows for large amounts of the medication to be inhaled. Disadvantages include that it's pretty bulky. If you have one, you know that it's also very loud. And I'm also sure that you know it's pretty expensive as well. A power source is also needed, and higher maintenance is required to work a nebulizer. Okay, now I'm going to go over the different classes of asthma medications. There are pretty much 2 main types of asthma medications. The first one being a quick relief style medication, and the second being a long-term control medication. The quick relief type of medication is pretty much used for emergencies when asthma exacerbations occur. These include classes of drugs such as, and if I'm going over these, I'm going to mention the names of them, but I'll go more into depth with them later on. So the first, for the quick relief medications, they are short-acting beta-2 agonists, anticholinergics, and systemic corticosteroids. And for long-term control medications, these include long-acting beta-2 agonists, inhaled corticosteroids, this type of drug called mast cell stabilizers, methylxanthines, leukotrienes, and immunomodulators. I know these sound foreign to you guys, but don't worry, I'll go more into depth with them later on and explain what they are and the common names of them. Okay, so the first class of drugs are the short-acting beta-2 agonists, and these include the common albuterol inhaler that you guys probably seen. They also include Ventolin, ProAir, and Proventil. It comes in inhaler and nebulizer form. It's indicated for acute asthma attacks only and only used for quick symptom relief, so it's not used for long term. If you use it too often, you should probably go see a doctor because, again, it's only for short symptom relief. The way it works is it helps widen the airways and it relaxes the muscles surrounding the airways. And side effects can include having a rapid heartbeat, having tremors, high sugar levels, insomnia, and headaches. And again, it should only be used as needed and not more often than twice weekly. Using it more than it should can deteriorate lung function, and you might need to intensify the drug therapy at that point. So everyone should have this if they have asthma, just for the acute, quick relief. And the next type of drug I will talk about is called anticholinergics, and these include ipratropium or Atrovent, or levobuterol, or Xopenex. It's also indicated for acute asthma attacks and quick symptom relief. It also helps reverse the signal of, or there's different types of signals in the body, and it helps pretty much reverse the signal that's sending into the body to constrict the airways. So you're pretty much preventing the constriction of the airways. Side effects can include dry mouth, dry eyes, rapid heart rate, and constipation. So to prevent this from occurring, just make sure to drink lots of water and eat lots of fiber so you won't get constipated. Also, don't forget to rinse your mouth afterwards to relieve the dry mouth. We're gonna go to a song now while I take a break. Alright, welcome back, listeners. So now we're going to go over the long-term drugs for asthma. The first type is called mast cell stabilizers. So like I promised earlier, we're going to go over what they are now. The mast cell stabilizers include common medications such as the cromolyn nebulizer. It's indicated for long-term prevention of asthma symptoms. It is an anti-inflammatory, so it will help with the inflammation caused by the asthma on the airways. Side effects can include a cough, irritation, and unpleasant taste. To combat these side effects, drink lots of water and definitely rinse your mouth after using it. The unpleasant taste can be combated by eating some candy afterwards, simple sugar like that. It takes about 2 weeks to respond, so again, it's not for short-term use. The second type of long-term acting drugs is the long-term beta-2 agonists, such as formoterol or salmeterol, or the Advair discus. And this is different from the short-term beta-2 agonists in that these long-term beta agonists are for long-term prevention of asthma symptoms. And it's also an alternative for exercise-induced asthma. Like the short-acting beta agonist, it is for relaxing the airway muscles. It is generally not used by itself for asthma management, so it should more commonly be used with other types of asthma medications to relieve the symptoms. Side effects can include a rapid heart rate and tremors. And if this does bother you, or someone you know who has asthma, just go talk to the doctor or pharmacist to have a different type of asthma medication prescribed. The next type of medication are called methylxanthines, and these include drugs. These include theophylline. It's indicated for long-term control again, and it's to prevent mild to moderate asthma. And once again, I'm going to stress that it's also not for short-term rescue use. Mechanism of how it works is that it also has an anti-inflammatory action to prevent the airways from inflaming. It can be associated with more side effects if the dose is too high. So if you're taking theophylline and you have side effects such as a fast heart rate, nausea, vomiting, seizures, or excessive excitability, then you should probably talk to your doctor to either lower the dose of your theophylline or switch to a different medication. But normal side effects can include insomnia and aggravated ulcers, and to prevent this, it should probably be taken in the morning. Okay, and the last type of medication I will talk about are the leukotrienes, and these include drugs such as montelukast or Singulair. It's to prevent mild to moderate asthma, and it's also for exercise-induced asthma. And when you use it for exercise-induced asthma, you should use it 2 hours prior to exercising for maximum effect. It also helps stop the allergic reaction in the body. Okay, and then now we're going to go into the inhaled corticosteroids such as Qvar, Promacort, Flovent, and fluticasone. It's indicated for, again, long-term prevention of symptoms and to control and reverse inflammation that might occur. It reduces the need for oral corticosteroids, which I will cover after this. It is an anti-inflammatory as well, and it reduces airway hyperresponsiveness. The side effects of these inhaled corticosteroids include a cough, redness in the skin, flushing, or a very hoarse voice. So make sure to ask your pharmacist or your doctor for a spacer if that does happen, because a spacer will help decrease the side effects that might occur. And it's very important to rinse your mouth after using these oral corticosteroids to decrease a fungal infection in the mouth. If the dose is too high, more side effects can also occur, such as for children, stunted growth can occur, and a chance of cataracts as well. For systemic corticosteroids, these corticosteroids are basically oral, which means you eat them instead of inhaling them. They include prednisone and methylprednisolone. They can come in liquid form or tablet form. They're both used for short-term and long-term use. Short-term use would be classified as 3 to 10 days and to gain control quickly for inadequately controlled asthma. Long-term prevention is for severe persistent asthma. Like the inhaled corticosteroid, it is an anti-inflammatory, and it decreases the mucus production in asthma as well as hyperresponsiveness of the airway. Side effects are also similar to inhaled corticosteroids, but it also has additional side effects such as an increased appetite, more fluid in the body, weight gain, and mood alteration. Long-term use can cause side effects such as thin skin, growth suppression, muscle weakness, and osteoporosis. So you should talk to your doctor about its use and determine the lowest effective dose to pretty much minimize the side effects, because these side effects are can be very crucial. And last but not least, there are many different types of combination products. These combination products include different classes of medications to maximize therapy. The Combivent is a combination of ipratropium and albuterol, so it's a combination of short-acting beta-2 agonist and an anticholinergic. The Advair Discus is a combination of fluticasone and budesonide, so it's a combination of both oral and inhaled corticosteroids. And Symbicort is a combination of formoterol and budesonide, so it's a combination of long-term beta agonists with a corticosteroid. So all these drugs help with asthma medication or asthma relief, and we're going to learn after this break about how to use these rescue inhalers and these dry powder inhalers.
What's up, guys? Welcome back. My name is Robert, and my section will be a tutorial on how to use some of the devices Andy has mentioned in his section. So there are 3 devices that I will be talking about, which will be the rescue inhalers, the dry powdered inhalers, and then the nebulizers. I will start off by talking about the rescue inhaler. So this is a standard L-shaped device which you probably have seen, will commonly see used by many. So first, you will need to remove the cap from the end of the inhaler, shake the inhaler about 3 to 4 times to prime, which is basically testing it. Priming is done to make sure the inhaler is delivering the correct amount of medication with each puff. The next step is to exhale all air from your lungs. Then, put the mouthpiece between your teeth and close your lips around it. You can also use a spacer with this. A spacer is basically a long tube attached to the mouthpiece that slowly delivers from the pressurized meter dose inhalers. What this does is that it allows more of the medication to reach the lungs, and less being deposited in the mouth and throat. Press the top of the canister and inhale by taking a slow, deep breath while pressing. Going back to the spacer, a good thing about using this is that it tells you whether you are breathing in too fast or too slow. If you hear a whistling, then you are doing it too fast. Hold your breath for at least 5 to 10 seconds. This will allow the medicine to reach all your areas of your lungs and begin to work. After, it may be necessary to rinse your mouth with water, depending on the type of MDI, especially if it's inhaled steroid, which can lead to unwanted side effects such as oral candidiasis, which is a type of infection in the mouth. The second type of device I want to talk about is the dry powdered inhaler. This is a circular device which you slide to open and close. The first step is to prepare the discus. How do you do this? You hold the discus in one hand while putting the thumb of your other hand into the thumb grip. Push the thumb as far as possible, and this will cause the discus to open and lock the mouthpiece into position. Hold the discus into a level position so the medication does not fall out. Slide the lever away until it clicks, which will load the discus. Turn your head away and breathe out as much as you can. Place the discus in your mouth and breathe as deeply as you can. Hold your breath for at least 5 to 10 seconds. Close the discus by placing your thumb into the thumb grip and sliding the grip back toward you over the mouthpiece. This will reset the inhaler so that it is ready to use for the next treatment. Last but not least, I will talk about the nebulizer. A nebulizer is basically, what it does is basically turns your asthma medication into a mist, so it's usually really easy and pleasant to breathe into your lungs. Be aware that if you decide to use this, your medication will be in liquid form. With a nebulizer, medicine goes into your lungs when you take a slow, deep breath for about 10 to 15 minutes. There are different kinds of nebulizers. Most nebulizers are small, so they are easy to carry with you. And most are air compressors. Other kinds exist, such as ultrasonic nebulizers, which use vibrations. These are quieter but also cost a lot more money. So how to use this nebulizer is that first you want to connect the hose to an air compressor. Then fill the medicine cup with your prescription. Attach the hose and mouthpiece to the medicine cup. Place the mouthpiece in your mouth. Breathe through your mouth until all medicine is used up. It usually, as I mentioned before, it takes 10 to 15 minutes. Some people use a nose clip to help them breathe only through their mouth, but for small children, it is better to use a mask. After completing your medication treatment, wash the medicine cup and mouthpiece with water, and air dry until your next treatment. Well, this wraps up my section of the devices used to deliver asthma medication. Be sure to be tuned in for our next exciting topic, which Alex will be covering different asthma triggers and what can be done to avoid them.
Alright everybody, welcome back. My name is Alex and I'm going to be going over asthma triggers. So what are asthma triggers? Those are things that basically cause your asthma to get exacerbated and bring about any sort of asthma symptoms. So what are the main asthma triggers? We have animal dander, dust mites, cockroaches, indoor, pollen, and outdoor mold, tobacco smoke, strong odors, sprays, vacuum cleaning, and other things like sulfites in food and beverages, cold air, and actually other medicines as well. So how do you avoid something like animal dander? You want to, at best, keep furred and feathered pets out of your homes. But if you can't do that, keep them out of your bedroom or sleeping area. And if that's not possible, remove carpets and furniture covered with cloth as much as you can, because the animal dander can build up there. Second, we have dust mites. And how do you get rid of those? You want to wash your pillowcases, your blankets, at least once a week to get rid of any of the dust mites, and reduce indoor humidity using dehumidifiers or central air conditioners. The next thing that you can do to reduce allergens is to get rid of cockroaches as much as you can, and you do that by keeping all of your food and garbage in closed containers and making sure to never leave food out. And then for indoor mold, you want to fix all your leaky faucets, pipes, or other sources of water that have mold around them, and make sure you clean any moldy surfaces with bleach. And regarding pollen and outdoor mold during allergy season, keep your windows closed. Stay indoors in the late morning to afternoon, as that's when those pollen and outdoor molds are most prominent. And ask your doctor if there's any sort of anti-inflammatory medicines that you can take for your allergies. Some other irritants, including tobacco smoke and strong odors like wood-burning stoves, kerosene heaters, and even sprays like perfume, hairspray, and paints can aggravate asthma. Vacuum cleaning. If you do a lot of vacuum cleaning and the dust bothers you, we recommend using a dust mask or a vacuum cleaner bag or a vacuum cleaner with a HEPA filter. Additionally, there are certain ingredients in foods and beverages called sulfites that can make your asthma worse, and to help prevent this, you should try to avoid drinking beer or wine, or dried fruit, processed potatoes, or shrimp if you find that they make your asthma worse. Additionally, cold air can cause asthma to worsen, so cover your nose and mouth with a scarf if it is cold or windy. And there are certain medicines like cold medicines, aspirin, vitamins, supplements, and things like beta blockers, which are for blood pressure, and those have been found to exacerbate asthma as well. Alright, we'll take a short break and then we'll close it out with Kristen.
Thanks for tuning in. That was the end of our session this week. Be sure to tune in again next week. We'll be having medical students from UC Davis come and talk about diabetes. And just a reminder that we have a Facebook page at facebook.com/scriptyourfuture1. So go ahead and like our page or follow us at twitter.com/scriptyfuture. And just to remind you to script your future. See you next week.